This video is about the problems that can occur with the distal radioulnar joint of the wrist. So this is the joint that can cause pain over the little finger side of the wrist, around this region just here. So if that's you, then keep watching, because you're going to learn all about the distal radioulnar joint, what can go wrong with it, and the treatments that can help. I'm Stephen Bunting. I'm an MSK physiotherapist and sonographer based in the UK. Welcome to my channel, where I discuss the common MSK conditions that affect everyday people and the evidence-based treatments that can help. The distal radioulnar joint is one of the two joints that connect the radius and ulnar bones together. These are the two forearm bones, and they are connected at the elbow end by the proximal or superior radioulnar joint, and at the wrist by our friend the distal radioulnar joint. And between these two joints, they allow the forearm to rotate from the palm up position, which we call supination, to the palm down position, which we call pronation. And these are really important movements in the function of the upper limb. This animation shows how the two joints work together to allow the radius to spin on its axis and pirouette around the ulnar in order to produce the supination and pronation movements. So knowing that the function of the DRU joint is to allow forearm pronation and supination, then it's going to be no surprise that it's these movements which are often painful and stiff when problems develop with it. So things like turning a key in a door, using a screwdriver, or even opening a door handle can cause pain. Other symptoms can be a grinding sensation like sandpaper when the joint is moved, and occasionally a clunking sensation, and we'll get into the details of why these symptoms occur in the next section. The distal radioulnar joint is a synovial joint, like most of the mobile joints in the body, and as such it can be affected by osteoarthritis, and indeed this is the most common condition that we see in the DRU joint. Now, I've done a separate video all about osteoarthritis, so if you want to know about the specifics of this condition, then check out the video up here, or I'll put a link in the description below. But suffice to say that osteoarthritis is a degenerative condition which causes a thinning and eventually a breakdown of the cartilage that covers the bones which form the joint. Osteoarthritis can be mild right through to severe, and the single most helpful investigation to diagnose it is a plain X-ray. This X-ray shows a normal DRU joint. This one shows mild osteoarthritis, and this one shows severe osteoarthritic changes where the cartilage has completely degenerated. There is bone-on-bone contact, and over time the head of the ulnar has eroded a section of the radius. This is called a scoop sign. And the symptoms of osteoarthritis are going to be pain and stiffness during pro and supination movements. And if the arthritis is more severe, then a grinding or grating sensation might also be evident during these movements. You might also notice a visible swelling of the wrist and a prominent ulnar styloid, which is this bone just here, as the bone margins become thickened and degenerative. The distal radioulnar joint is also one of the joints commonly affected in rheumatoid arthritis. Now, this is a very different condition to osteoarthritis, but some of the symptoms can be similar. Now, I've also done a separate video looking at the differences between rheumatoid and osteoarthritis, which I'll link to up here and again in the description below. The main symptoms of rheumatoid arthritis in the hand are pain and swelling, which most commonly affects the knuckle joints, but also the distal radioulnar joints, usually in both hands. Pain and swelling of these joints at rest, and particularly joint stiffness first thing in the morning, which can last for over 30 minutes, can be a sign of rheumatoid arthritis. If in any doubt, then please do get checked out, as early diagnosis is the key to preventing long-term joint damage. The other main issue that we see in the distal radioulnar joint is instability. If you've had a wrist fracture or a bad sprain, then you can disrupt the ligaments which support the DRU joint. There are ligaments all around the joint itself, and also a large thick tissue called the interosseous membrane, which binds the radius and ulnar together along their whole length. A major disruption to any of these ligaments can cause instability of the DRU joint. Symptoms can be similar to osteoarthritis in that you're going to have pain over the ulnar border of the wrist during pro and supination movements, but there will usually always be a history of injury, and the joint might feel unstable, almost wobbly, and the joint might click or clunk from time to time if it's unstable. Clinicians use a test called a piano key sign to check for DRU joint instability. The wrist is placed into pronation and the position of the ulnar is observed compared to the radius. In instability, the ulnar is often more prominent when compared to the other side. The clinician then pushes down on the ulnar head and notes the amount of movement available. The ulnar head is then released and any movement is noted. If the ulnar head springs back up, like a piano key, then this is a positive test. Results are always compared to the other side though, because some people's DRU joints are naturally more springy than others, which might give a false positive result. Imaging wise, X-rays don't pick up instability very well, but they can of course rule out arthritis. To diagnose instability, an MRI scan, or even better, an MR arthrogram is the best investigation, as they can image the ligaments which are often injured in this condition. The first thing I'd probably suggest if you have a painful DRU joint, no matter what the cause, is to use a splint in order to rest the joint and allow it to settle down. If your problem is osteoarthritis, then a general wrist splint can be helpful. Unless you splint or cast the whole arm from elbow to wrist, then you can't prevent pro and supination, but using something like this will support the wrist and keep it in the optimal position while you are pronating and supinating the joint. If the distal radioulnar joint is unstable though, then a different type of splint is required. You're going to need something which compresses and supports the joint by squeezing the distal forearm like this. Specific DRU joint supports can be found at 3pointproducts.com and also at Push Braces. I'll put links in the description for both of these companies. Just be wary though, because these splints will only work well for instability or ligament injuries. If you have an arthritic joint, then squeezing the joint surfaces together is not the best idea, and this type of splint is just likely to aggravate it. I would suggest wearing a splint throughout the day for up to 6 weeks or until the pain settles down. Using anti-inflammatories such as ibuprofen can also help. Just check with a healthcare professional first though, as not everyone can take anti-inflammatories. And during this time you should of course try and avoid any strenuous or painful movements which might just aggravate the joint. Hopefully, once the pain has settled, you can then start to slowly wean yourself off the splint and then introduce very gentle exercises. At first this will be just simple pro and supination movements, and if you can manage that without much pain, then you can start using some resistance. Doing the same movement with a rolling pin or something with a weight at one end like a hammer will work well. Over a few weeks you can hopefully restore movement and strength, but be patient. The whole process of rest and then progressive recovery can take at least 3 months. If the pain doesn't settle with these simple treatments and the passage of time, then the next step, particularly if your joint is arthritic, is a cortisone injection. This can be really helpful in settling down an irritable joint, which might be painful or swollen. I do these using ultrasound guidance just to ensure accuracy. And the last treatment option is surgery. The type of procedures available will depend on the diagnosis. If the joint is unstable due to a ligament tear, then surgery will involve trying to reconstruct the ligaments that were injured in an attempt to stabilise the joint. There are many different ways of doing this depending on which ligaments were injured and the degree of instability. And this is beyond the scope of this video, but you're going to need to discuss your case with an upper limb surgeon who specialises in soft tissue reconstruction. And if your joint is arthritic, then there are other procedures used. And again, there are a few different options which vary from a partial resection of the arthritic ulnar head to a full joint replacement. And again, you're going to need to discuss your individual case with a hand surgeon. Okay, so we're nearly done. The final thing to mention is that if you do have ulnar border wrist pain and you're watching this video thinking, the DRU joint doesn't seem to fit with my particular problem or symptoms, then do keep an eye out on my channel, as I will be covering some of the other conditions that can also cause ulnar border wrist pain over the coming weeks. So that about wraps things up. I do hope you found the video helpful. Thanks very much for watching, and bye for now.